Welcome back. It's 9/18. February is American Heart Month, a time to emphasize the importance of heart health and raise awareness.
Heart disease continues to be the leading cause of death in the United States, responsible for nearly 1 in 5 deaths each year. Joining us to share valuable tips and insights on maintaining a healthy heart is Dr. Norma Keller. She's the Director of Cardiology, Quality, and Safety at NYC Health and Hospital. So great to see you, Dr. Keller.
Good morning. Thanks for having me.
So I guess who is at the highest risk of heart disease, right? Because we hear so many different things when it comes to this.
Yeah, so we're all at risk for heart disease, as you mentioned. You know, even we need to start practicing even young in terms of preventing heart disease later. If you have risk factors for heart disease, you are at more risk, and some of these are silent. You're not going to know if you have diabetes unless you have your glucose checked. Hypertension or high blood pressure is another risk factor for heart disease. Smoking, family history, obesity, lack of exercise, all of those things put you at higher risk. Diabetes and high blood pressure, smoking are really, really significant risks for not just heart disease, but also for stroke. So if you make impacts in terms of preventing heart disease, you're also going to prevent stroke in most cases too, so an added benefit.
Yeah, I mean, just because you're not considered at risk doesn't mean that you can't develop issues.
Absolutely,
right?
Yeah, even in your 20s, you can start building up plaques, and so it's important to really institute a healthy lifestyle early on in our youth.
But what would be the warning signs, though, for someone, let's say, okay, well, I'm healthy, I don't have any history, it's not hereditary.
Yeah, so sometimes there aren't a warning sign, which is why it's so important to screen. And to make sure you know what your blood pressure is, you know what your cholesterol is. In fact, half of men, their first symptom or manifestation is either dying suddenly or having a heart attack. So it's very important to screen for that reason. However, if you're having symptoms like chest tightness, shortness of breath, that can be a worry sign, particularly with exercise.
Okay.
But really, really important to screen for heart disease before symptoms occur.
So what are some of the simple things you can do to kind of change it away, to prevent it, or if you have heart disease, to kind of get rid of it?
Yeah, and those measures help to prevent as well as manage heart disease when you have it, or even mitigate the disease. And it's really every aspect of your life. So even getting a good night's sleep, taking good care of your teeth in the morning, eating healthy, incorporating exercise into your life, managing your weight, knowing your blood pressure, and then incorporating exercise at work or at home, and also managing stress. All those things can impact heart disease and the activity of heart disease.
Did you say taking care of your teeth?
Yeah, so
what?
Yeah, you know, having healthy teeth also can help with having a healthy heart as well, in terms of infection. And also, inflammation can also influence heart disease in its activity.
And it's always good to get started early with the kids.
Absolutely. So if kids just incorporate into their daily life, you don't have to think about it. It's so much easier than trying every New Year's or every heart month to try to get back to healthy living.
When you say heart disease, I guess, is that broad? I mean, what does it mean?
It's very broad. Probably the most common thing people think about with heart disease is blockages in the coronary arteries. And what you're referring to, most of those deaths that occur are from heart attacks. So if fatty plaques build up in the artery and they get to a point where they can actually obstruct flow, where you might get symptoms of a heart attack, or angina, where you have this chest heaviness. And then they can actually rupture and break and expose the blood to all this inflammatory material and fat that's there. And a clot can actually obstruct the artery completely. And actually, a part of the heart muscle then would not get any blood flow. And that's when you would have a heart attack. And there, it's very, very important to recognize that and call 911 and get early treatment, because the earlier you treat a heart attack, the better you're going to do and more lives you're going to save.
I mean, I guess the bottom line is be proactive instead of just being reactive.
Absolutely, absolutely. And being really partnering with your healthcare provider and knowing your numbers, and that can also help, because, you know, if you see your cholesterol coming down, your blood pressure coming down, it's positive reinforcement to continue to do that.
Well, how often should we get tested then?
Yeah, it depends. If it's just screening once a year, I would recommend.
Okay.
But even children should get their cholesterol checked at least once in their early childhood to make sure they don't have a hereditary form of having high cholesterol.
That's why those yearly physicals are so important that people put off every year. I'll do it next year. No, do it every year. Great to see you, doctor. Good advice.
Same
Thank
here.
you.
Thanks so much.